I'm going to be your CNA for today, and I'm going to be performing newborn umbilical stump care. So, baby born umbilical cord is going to be cut once the baby is out. So, what we need to do is we need to clean it, and usually it will fall off or drop off by itself within 7 to 10 days. So, what you have to do with your newborn baby is you don't need to tear it off. Even if it's hanging by a thread, because it will just fall up on its own. Okay, so we will start, and what we need to have for the equipment or for the things that we need to have to clean the umbilical cord is it's either a Q-tip or cotton balls and a towel. Okay, so for the procedures, first what you need to do is after you bath the baby, you have to pat dry the umbilical cord and just pat it gently. And then after that, you need to ensure you put the baby back in a lying position, and it's either you use Q-tips or cotton balls. So you don't need to use cotton balls with alcohol, because for the cotton balls, what we need to do is we need to damp it from a boiled water that is already cooled down or cooled off. And what we will need to do, if this is the umbilical cord of the baby, so if this is the umbilical cord of the baby, you will just clean it on the side to make sure that it's clean, and also on the crevices you need to ensure that it's clean, but just be a bit gentle so that it will not fall out. Again, it will just fall out by its own. And then after that, what you set the cotton balls aside, and then when you are going to be putting the baby's diaper, you need to ensure that there's a room to breathe for the umbilical cord, because you need to keep it dry. So some people or some parents, what do they normally do is they put like a hole. They put a hole on the on this side, or they cut it so that the umbilical cord it will not be covered, because it needs to breathe for it to heal like a bit faster than the usual. So I'm gonna be putting the baby's diaper. So in my case, I'm gonna be folding it, and I'm gonna be folding it, and then you have to do it a bit faster because the baby is sensitive. Like, they don't need to be exposed like naked. Okay, so you're done. So you just make room for the umbilical cord to breathe. And one more thing, just in case, it rarely happens if there's an infection. So infection means like there's a yellowish liquid on the umbilical cord, it's swelling, or it has redness. So what you need to do is to check with the doctor. But it rarely happens. Okay, so that's it. Prepare all our equipments needed to clean the infant bottles and the nipples and everything. So what you need to have is at least 3 basins. You need to have a sponge. You need to have a nipple brush, and then bottle brush. So all of it needs to be clean. So first is what you need to do is you need to fill in the basin with warm soapy water. But before doing that, make sure that everything is separated, like bottle, nipples, and the bulbs are separated. So this is how we do it to ensure that we will be cleaning it one by one. Let's put it here. So the basin needs to have a fluid amount of water so that you can be able to wash it. So right now, this basin, just imagine that it's filled with water. It's filled with the soapy water. So the first thing that we're gonna be doing is to clean each bottle thoroughly. So you have to brush. You have to brush it. Make sure that every leftover milk is removed from the inside. Okay. So you do it through every bottle that you have. And after that, you also will be cleaning the nipples. Make sure that you clean it from the inside out. So every nipples should be clean. And after that, also you have to, this is a sponge, so you have to clean the bottles outside. Clean it thoroughly. Make sure it's already clean. And also the valves, make sure that there's nothing in it, so you have to clean it. Usually this should be done using running water. Okay, so once we're already done with everything, what we need to do is do a running water. So we will rinse it one by one. So make sure that when you rinse it, like from the inside also, you ensure that there's no soap and every soap residues in there. So after you rinse it well, you need to put it on another basin. The reason why we're putting it on another basin is because we need to air dry everything. Okay? Once it's air dry, then that's the time that we move on to the next procedure, which is called sterilization. So there are two types of sterilization. So first is sterilize by boiling, and second is to sterilize using like an equipment. But today I'm going to be showing you how to sterilize using a boiling water. So if all of these are air, so if all of this are already air dried, just make sure that your hands are clean. You do the proper hand washing and all. And then what you need to do is to put a water on the pot, inside the pot, and then boil it. Once it's already boiling, then you gently you boil this bottles, nipples, and valves for at least 5 minutes. And after that, you switch it off, and then you use it. You take it off again using a clean tongue. So we're gonna be using the next basin, and then put it there. So we're gonna be using a tongue, like one by one, because it's very hot. Just make sure you don't hurt yourself. So you're gonna be using a tongue to take it and put it on the other basin. So just imagine if it's already on the other basin, so you can be able to air dry it. And then after air drying it, you need to again do the normal hand washing, and you actually have the option to put it on your bottle container, or if you have like a bottle rack, but make sure that it's not going to be contaminated. Keep it dust free and dirt free. So there you go. Those are the basic things that you need to do in order to perform cleaning the bottle and sterilizing. The second one option is like you just have to follow the manufacturer's guide for the equipment. Thank you.